Next presenter, Dr. Jatin on neurodevelopmental outcome at 18 to 36 months of age among cool neonates with moderate to severe HAE, a cross-sectional study.
Good morning, everyone. I am Dr. Jatin. I will be presenting our study neurodevelopmental outcome at 18 to 36 months of age among cold neonates with a moderate to severe HAE. This is a cross-sectional analytical study. So the background and rationale of the study is there is a scarcity of data regarding the long-term neurodevelopmental outcome in this population, especially from the low middle income country setup. So we are trying to provide some extra information from the children who are under follow-up in our high-risk follow-up unit. So our primary objective is to determine the prevalence of the major neurodevelopmental disability at 18 to 36 months of age among inborn neonates more than or equal to 36 weeks of gestational age with a moderate to severe HAE and who underwent therapeutic hypothermia. Our secondary objective is to identify the distinct prenatal and perinatal risk factors associated with the same. So we have defined major neurodevelopmental disability as presence of any one of the following. This is cerebral palsy as per the surveillance of cerebral palsy in Europe definition with a functional disability FCS level 2 to 5, or Bailey 4, BSID 4, cognitive score or motor score less than 70, or the child is blind or can only perceive light, or a profound hearing loss, that is inability to understand commands despite amplification. We have defined a minor neurodevelopmental disability as presence of any one of the following: BSID score, cognitive or motor score between 70 to 84, GMFCS level 1, a moderately reduced vision but better than severe visual impairment, or blind in one eye and good vision in the contralateral eye, or a hearing deficit that is requiring amplification to understand commands. The study is it is a cross-sectional analytical study conducted in our high-risk follow-up clinic. So our inclusion criteria include inborn neonates, gestational age more than or equal to 36 weeks with a moderate to severe HAE and undergone therapeutic hypothermia, born between June 2019 to May 2021 and discharged from NICU. We have excluded major congenital malformations, inborn errors of metabolism, genetic syndromes, and if we are not able to contact them over phone, even after 2 attempts, we have excluded them. So sample size, assuming the prevalence of developmental delay in the study population to be around 20%, alpha error of 5% and power of 80, the sample size was calculated as 105, and we plan to recruit additional 20% to consider the dropouts. So therefore the final sample size of 126 was taken. So we have around 236 babies were suffered perinatal asphyxia during the period, and we had to exclude 124 because either they didn't receive cooling or incomplete cooling or expired before discharge. So rest 112 babies were there, and among them we tried to contact them, but 8 of them expired after discharge. We were not able to contact them because of number not in use or wrong number for around 35 babies cases, and 9 people didn't come for assessment. So finally only 60 babies we were able to enroll in the study. So categorical variables we have analyzed using chi-square Fisher extract, and continuous variables, normal distribution with independent t-test, continuous with non-normal distribution with the Man-Whitney U-test, and we have used a Poisson regression because the binomial logistic regression thing didn't converge. So the characteristics of the study population at birth was a mean gestational age of 38.8 with a standard deviation of 1.3 weeks and a mean birth weight of 2894 gram with a standard deviation of 430 gram. Around 47 babies had a fetal distress in the form of pathological CTG. 42% of the cases were delivered via cesarean section, and around only 2 babies received extensive resuscitation among our study population. That include chest compression and adrenal embolysis. The median Apgar score was at 1 minute was 3 with a range of 2 to 4, and the median Apgar score at 5 minutes was 6 with a range of 5 to 7. Mean cord gas mean pH was 7.05 with a standard deviation 0.14 and base deficit 15.21 with a standard deviation of 4.35. Most of them were belonging to moderate HAE category. So we assessed with a at the time of assessment, around the median age was 35 weeks, and significant 15%, a significant proportion had underweight and stunting. And one interesting finding was around 30% of the babies had microcephaly. Many of them were actually normal in development. So the primary outcome of prevalence of major neurodevelopmental disability was 9 out of 60, that is 15%. And the prevalence of cerebral palsy was 13.3%. Major cognitive delay, that is BSID standard score less than 70, was 15%. We had 3 babies who had vision impairment, and nobody was having hearing impairment. Coming to the secondary outcomes, the univariate analysis of the perinatal factors, we found meconium stain, lichar, and severity of HI within 6 hours using Cerner staging as significant. The Apgar at 1 minute, 5 minute quad pH based deficit, etc., were not found to be significant in our study population. In the neonatal comorbidities, the presence of neonatal seizures and was found to be significant, and the requirement of ventilator support more than 24 hours was statistically not significant, but clinically it was significant. And the regression model, we found a neonatal seizure as the significant with a p-value of 0.04. Severity of HI, we had a p-value of 0.056, so it was not statistically significant. So minor disability in the group was around 11.6%, and there were 4 babies with a seizure disorder, that is 7%. So there was the mean cognitive language motor BSID scores were comparable, around 86 to 90. And there was a significant difference between cognitive language motor scores in the major group versus the no major delay group. So comparing to the previous studies, previous published papers, our study had a 15%, which is comparable with more than the helix travel, which belongs to the low middle income category, Sri Lanka, Bangladesh, and India. Others were from Western countries, they had a higher major developmental delay. So strength, we have evaluated the prevalence and analyzed the risk factors, and this is the first, to our knowledge, this first study to use the BSID 4th edition for the neurodevelopmental assessment of the set children. And limitations, we were able to enter only 60 children, though the proposed sample size was 126, majorly because of the COVID pandemic. And implication for the future studies, long-term outcome beyond 3 years of age from low middle income countries is the need of the hour. So conclusion, among the cold neonates, 15% developed major neurodevelopmental impairment by 18 to 36 months of age, and 13.3% developed a cerebral palsy. So the presence of neonatal seizure was associated with a major neurodevelopmental disability at 18 to 36 months of age, and the finding further emphasis the need for prolonged follow-up. Thank you. Moderate to severe HI, madam. Yes, madam. Means we have got a criteria in that pH less than 7.0 and base excess more than minus 16 is taken as the one cutoff, one parameter actually.
So you've taken severe asphyxia cases.
Moderate and
also.
severe we are cooling, madam.
Okay, yeah. And what study you did to do the outcome, study the outcome? What and all parameters you took to study the outcomes?
Risk factors we are asking.
Yeah.
Madam. Actually, maternal comorbidities we have taken. Neonatal, the neonatal comorbidities during the NICU stay we have taken. These parameters we have taken as a to find out any risk factor is there for major delay or not.
Okay. You've not done any imaging or anything like that?
Imaging, actually because of the COVID pandemic, so many babies, we were not able to do the imaging. It was a cross-section study only, madam.
Okay.
They lost follow-up, actually, majority of the babies. We had to call them back. So imaging that time
how long did you follow them up?
In our clinic, usually up to 5 to 6 years we are following up. And then they will go to the pediatric area.
See, what is the protocol for the follow-up of these babies in terms of, say, any intervention
Yes,
which you have looked at in these babies?
We are having an intervention clinic attached to our high-risk follow-up unit, sir. So the therapy is also actually developmental speech therapy, physiotherapy, everything is being given during the follow-up visits.
No, what we are talking about is a mother-based early stimulation program, whether these babies are on any stimulation programs rather than intervention programs. before your assessment, no, 18 to 36 months. So what were these babies going through? Because you told COVID. So are they able to go for regular mother-based stimulation practice? Are the
yes, sir.
group 60 is homogeneous in terms of the levels of stimulation and intervention they are receiving?
Yes, sir. We had, during that COVID pandemic, we had a tele-consultation, and we have trained the mothers, PINS parents actually, over phone, the things to be observed, things to be done.
Because yours looked at 18 to 36 months. So has these babies had any regular follow-up before that period?
Yes, sir. All these babies were actually like the babies who were born during the COVID pandemic period, that 1 year, those babies actually, OP were not there for 1 year almost. So they were not under regular follow-up. We have to call them back again. But after that initial a set of people, other babies were actually under regular follow-up.
So have you looked at the data whether there is any difference between the outcomes in these two group of babies who have received intervention and no intervention before 18 months?
We have actually not looked like that, sir. We didn't compare like that.
Okay. And other thing is you told GMFCS you applied.
Yes.
So less than 2 years. Tell what is GMFCS 2 or 3?
Actually, less than 2 years, there was a modified for infants. It is
Yeah. So tell what is 2.
2 will be like sitting with some support in the lower back, and the baby will be able to move the arms and all. So,
Yeah. So technically this is a very good study actually. Good.
Thank you. Of course, was there any other investigative modalities done like ultrasound to see any changes were there in this thing, as well as MRI scan in these children?
actually, some of the babies only got MRI done, sir, because of the lost follow-up and the pandemic. So among the babies who had major development delay, around half the percentage only got MRI done.
So what is the hypothermia protocol which is which you use, because there are differences, in the. So what is your this thing institutions? You are an institute or you are a private
Institute,
hospital?
sir.
Yeah. So what is the methodology being adopted?
For the
methodology of hypothermia, of course, it's
Hypothermia.
standardized, and there are a lot of criticism about studies from India in some.
we are using this face changing material,
Because
PCM
it's now
materials.
standardized in most of the places. So how long you are giving, and what is
We
the
are starting within 6
methodology?
hours, and 72 hours will be continuing. After 72 hours, we'll be monitoring the baby, the lab parameters, clinical parameters during the 72 hours. And after 72 hours, slow
So in
revamping
this
over
study,
6
you were
hours.
involved in assessment of all the cases, or others also? No, you were involved in assessment of all these babies throughout the study, or no? As this thing, you were only doing the study,
Yes.
but you were involved in assessment of all the studies, all the children.
These 60 babies I have done the assessment, sir.
That's what I
Yeah,
want.
yes, sir.
Okay, so it's a combined this thing. The other people are involved. Thank you.
Did you use for the outcomes? You use initially you said BSID was used.
BSID was
Then
used.
you also have used GMFCS. So
Uh,
outcomes are based on what?
Actually, major developmental delay we have defined as one of the following actually, madam. So GMFCS levels were 2 to 5, or BSID cognitive or motor score less than 70, or the vision and hearing impairment, severe impairment we have considered as major
so
delay.
BSID is that will also include your motor, everything, isn't
Motor
it?
and cognitive alone we have taken,
Yeah.
less than 70, madam.
Okay.
Thank you.
Thank you, judges, and thank you, Dr. Jatin.